Well, hello and welcome to Sunset TV. You're watching India Fights Back with me, Rajat Kain. In this edition of the show, we'll focus on the need to step up vaccination. Well, our focus primarily will be on discussing how are we going to ensure that vaccine reaches its target group as well as no one is left behind. There have been reports that there are some people who are still lagging the vaccination facility or perhaps may lag in terms of their dependence on primary tools, as if they don't have access to, say, internet or smartphones whereby they can register on the app and therefore they can book an appointment. Well, all these issues will be discussed threadbare in this edition of the show with our guest, Professor Narendra Kumar Arora. He is Chairman, COVID-19 Working Group. Many thanks for joining us, Professor Arora. And Dr. Rohit Sarin, former Director, National Institute of Tuberculosis and Respiratory Disease. Many thanks, Dr. Sarin, for joining us. Let me start with you, Professor Narendra Kumar Arora. Sir, in terms of giving vaccination to the target groups, what are mechanisms in place which ensures that vaccine reaches the group?
So it is primarily the strategy is to have strategic location of vaccination centers so that anybody in any part of the country is able to access the immunization center without difficulty. It should be within reach. And that is the fundamental issue that if we need to reach the urban poor or rural India, the immunization centers have to be set up in accordingly. And in this context, I would like to share that we have a huge experience of routine immunization for children and women, because antenatal mothers all get vaccine, the tetanus toxoid. So India has the capacity to reach every nook and corner. And at any time, almost 100,000 immunization centers are there which are delivering pediatric vaccines. And in fact, I must say this system is particularly robust in rural areas as compared to urban areas. And today, as we expand, the expansion is twofold. One is government sector, the other is private sector. And as all of us know, private sector is primarily located in urban areas. So they are providing a very great support to the program. On the other hand, the initial experience is with hospitals where backup services in case if there is an uneventuality takes place. So there are district hospitals, dispensaries in urban areas, and in rural areas, PSCs and CSCs, primary healthcare and community healthcare centers are there. And now as the program matures, we need to further spread out, go to village and sub-center level. And that is the need now.
Right. So as we progress through the program, we need, of course, like these measures so as to have vaccine reaching to the last point of the person or individual concern who is targeted in the group. Well, Dr. Sarin, here it's important to understand the vaccination process and all, like how this vaccination process I'm asking for, it's different from the previous vaccination drives we have had in this country. We already know that this is perhaps the largest mass immunization program in the world at this stage. So how this vaccination drive stands different from the others? And is that difference throwing up any challenges for the workforce engaged in it?
Well, I think it's quite obvious that the vaccination program, which already exists for other illnesses, is primarily for the children group.
Right.
And then maybe for the pregnant mothers. You see, now that,
absolutely.
So that at a particular group, everyone is familiar with. If it's an expecting mother, she would, for the welfare of her child, be really concerned that she should be vaccinated. And similarly, if there's a small infant or a child in the house, the parent would be concerned that we need to provide vaccination to our little ones. So you see, they are more proactive. They come to the centers and the health facilities to get themselves vaccinated. Here in this COVID vaccination, there are a number of factors. One of them is that, well, yes, the adult population is being considered for vaccination. And this is a group which is, first of all, not having any symptoms per se, and they do not have a felt need for the vaccine. Secondly, you see, the adult population also have their own commitments, whether it is work-related commitments, and therefore, you see, especially now you find that mainly the vaccine is being taken by the affluent class rather than the economically poorer sections of society. Probably that could be a reason that they are more involved in their daily wage and they don't want to come to a health facility for vaccination when they do not foresee any problem. Thirdly, I will say that the vaccination drive, when it started, we were not very certain or clear about the efficacy of the vaccine, about the side effects of the vaccine. Everyone was apprehensive that whether taking the vaccine would lead to any untoward effect, and data was not available to support that, yes, it is really very safe and it is very effective. Today,
Right.
things are a bit different. That the country has vaccinated over 2 crore of the people at large, and there is definitely less of skepticism about at least getting or taking this vaccine, especially amongst the educated class. Also, earlier, even this particular section of society was very scared and apprehensive. But today, now we find that the individuals getting vaccinated every day is on the rise. However, it is far below what one would expect, and what one had anticipated and what one had provided for at the beginning of the drive. I think everyone is aware that we had considered vaccinating about 30 crore population, and now till date we have only about 2.5 who have received their first dose, and only about 45 lakhs who have received the second dose. So I mean, this tells us that we are far from our targets, and we really need to see how to go ahead in a more aggressive mode to promote this, how to educate the society at large. And I would say that until and unless that is done, probably what we started to achieve, we will fail in the effort.
Right, right. Many thanks, Dr. Rohit Sarin. That's really important issues that you raised here. Professor Arora, would like to respond to it. Like, are we still off target? Is it that? Is it something still wanting in our vaccination drive, which is making us cover the shortfall, which perhaps will make us cover the shortfall? I beg your pardon.
Yeah. So I will take you back to 16th of January. We started with 3,000 immunization centers.
Right.
And today we have around 20,000 immunization centers. And coverage will be directly linked to the number of immunization centers. And that's why I mentioned in the beginning that we have a capacity to go up to anywhere between 50,000 to 100,000 immunization centers plus private centers. So, it's a marathon. So, and as very rightly mentioned by Dr. Sarin, that in the initial period, one is worried about safety issues, the concerns of the community, concerns of the medical professional, establishing supply chain and other issues. So now 7 weeks from starting from that place, I think the program is almost matured. And over next few weeks, 2 or 3 weeks, you will find very rapid expansion. And very rightly mentioned that if we have to reach out to the rural population, and because the priority segment is present in practically every home. I mean, 6 to 8% of our population is more than 60 years. So every village has elderly and they have to be reached. And unless we expand, the second issue is very rightly that urban middle class and upper class are kind of more technology savvy. And we need to go out down to make it simpler so that we are not entirely dependent on technology. but a bit of a kind of a facilitatory movement of the beneficiaries is to the immunization center is done.
But sir, like in terms of my question is to you, sir. Like, we know that there has been there was hesitation initially when we started off. That has been addressed, and now, of course, those questions and those apprehensions may not be there. But why does still a gap persist when it comes to the immunization? Are there some groups, say for instance, poorer people or people who don't have access to, say, smartphones or internet? They're not able to cobble up to go to vaccination centers.
So we should be aware there are two things. One is that 3 weeks back, that flexibility was allowed that you can just walk in and get yourself registered, and if there is slot available, you will get the vaccine.
Right.
And for most of the rural areas or poor areas, that would be the preferred mode for a lot of people. There is also an effort to extend the timing of the immunization center. The reason is that those who are poor can go early morning or late evening so that their daily wages are not affected significantly. And the third thing is that although we are saying we are slow, but I would suggest and request the viewers that they should utilize even the existing facility to the hilt. Today we have 20,000 immunization centers, so that we should be able to immunize 2 million new people. That means first dose and 2 million second doses. Then only, I think, because our daily capacity today is 4 million. And so even the current capacity is underutilized. There is no shortage of vaccine. There are no stockouts. So the community also needs to be nudged and requested and mobilized to come and take the facility.
Right. Dr. Sarin, just continuing on your previous point about there is still like we are, it's still like lesser than expected in terms of footfall when it comes to vaccination drive. Is there a pattern that you have seen? Like, is it more of, say, rural-urban phenomenon, or perhaps people who are lesser, accessible towards technology? They are the ones who are still behind in terms of taking vaccine. Is there a pattern that you've seen when you spoke about that shortfall?
Well, I think I also mentioned that it is primarily, the affluent class, the more educated class, which is, really coming forward. And that also in the recent weeks. I mean, as I stated that earlier, things were a bit different. But for the past few weeks, when apprehensions have been allayed, then the numbers have risen. But then, even within the rise in numbers, we are still not getting the poorer sections of society to avail of this facility. Now, either it is related to the outreach not being available to them in terms of the education part of it. That means that, okay, they do not really understand the implication of getting vaccinated.
That's important. Yes,
They are
that's
not
really
only
important.
protecting themselves, they are protecting society at large. It is not if an individual in a household gets vaccinated, it's not that it is only for that individual, it is also to protect the others within the family if he gets vaccinated, in the neighborhood which gets vaccinated. So these aspects, you see, have to reach out to the larger society, because the larger society is not the affluent society. The larger society is the middle class, the lower middle class, and the poorer sections. That is the larger section. And we have to see how to address their concerns. Yes, government has taken on this initiative to take care of, those without mobiles, those without internet facility available. They say walk in, just carry some form of identification, whether it is your Aadhaar card or any other form of identification. And the center itself will have the facility to register you and provide you the vaccination facility. Further, government has also increased the timing. I mean, just recently they said that, okay, vaccination would happen even 24 hours.
Yes, we are hearing about
that
it.
is
Yes,
throughout the day. Yeah. So, I mean, these measures definitely government has taken, and we are hopeful that they will, speeden up the vaccination process. But until and unless the society at large will get, aware on, educated on the fact that the role of the vaccination in the whole process, they will not come forward. And no, you see, you can take the horse to the water, but you can't make it drink. It is something like that. You may provide all the facility. As Professor Arora has said, that in fact, these 20,000 centers which have been set up, that is not the limiting factor today, because these centers are also not fully utilized. If you look at are we able to give every day 20 million doses? We are not. That is a fact. And I will say that we'll have to mobilize it. It has to be a Jan Andolan, that okay, vaccination has to be given, has to be taken, and society has to move in that direction.
So, Dr.
And I
Sarin, let me
think
just ask you one question here. Like, I mean, that's important point you have raised here. We have certainly created awareness about that this vaccine is safe. Are we, in terms of a messaging, do we still need to convince people that this vaccine is also necessary? Is it so? We have told people perhaps have been largely convinced, yes, vaccine is safe, there is no need to hesitation here, but are we giving enough messaging that this vaccine is necessary? First you, Professor Dr. Sarin, and then I'll take it forward to Professor Arora. Sir.
Well, I think somewhere we are missing, this link, because even though we are talking about safety of the vaccination, we are also talking about efficacy of the vaccination. But we are missing the point that it is required for the larger society also. As I said earlier, every individual getting vaccinated not only protects the individual, but also offers benefit, as herd immunity will rise, so the transmission will get cut, and then this virus we will be able to conquer. Until and unless that happens, you see, the virus we are hearing, it is multiplying, it's mutating. Some strain is coming which may be useful, some strain is coming which may not give you the vaccine protection for that strain. So, I mean, all those things are happening. Therefore, it is very important that rapidly we'll have to act. Rapidly, we'll have to be more aggressive in our vaccination program. And for that, I think educating the masses is the
Important.
most critical component.
Right,
And if we miss out on that, well, in spite of the fact that we have all the logistics in position, we have all the apps in position, we know everything, who all to be vaccinated, and but still, we will miss the bus. That is what I would like to convey.
Right. Dr. Sarin, just stay on. Professor Arora, do you also agree that we have given a tremendous message that this vaccine is safe, whereas when the messaging of the necessity of the vaccine comes, this is one area where we need to work on. Is it so?
I think this discussion has brought in a very important point. We have crossed the first hurdle. That means getting the confidence of the community that vaccine is safe. Next challenge is of social mobilization or Jan Jagran and Jan Abhiyan banana ke liye. Now, for that, I think there are 2 or 3 things. One is that now the programs should start focusing on the value of vaccine. I will go in the reverse order, that every individual has to be emphasized that you are getting protected. You are in priority list, because if you get the disease, the risk of your death and serious disease is very high. The second is that if you are protected, you are protecting indirectly your family. And then the larger, because I think most of us as human beings, like me and my family becomes very important, and then this whole concept of community protection. So one suggestion, and maybe both of you can comment, that now is the time to bring in beneficiaries, those who have received vaccine, getting their live reactions, that how do they feel after getting the vaccine, And that will further reinforce the confidence of the community from all sections of society, whether poor, rich, middle class, slum dweller, or villager. Because I think that now next phase of pushing the vaccine program is necessary.
Professor Arora, just as we go towards the close of the show, I have one question for both of you. Let me start with you, Professor Arora. In terms of herd immunity, both of you have mentioned the significance of herd immunity, and this is, of course, like that is a threshold that we need to achieve. What per you is perhaps a number that you're looking at as an expert, the number of herd immunity in terms of the proportion of population in the right grouping that will at least give us a sigh of relief that now we can say, okay, we are getting towards the end of the pandemic. I know pandemic is not over yet, but the numbers in terms of herd immunity, what is that looking at?
So first of all, the very concept of herd immunity is very nebulous. We really do not know how do you achieve herd immunity. In polio, almost 98% were immunized, then only that transmission could be interrupted. And the problem is that herd immunity is on the assumption that the number of cases and the number of immunized is randomly located, but in community does not happen. There are clusters who are completely unimmunized. Now that just breaks the whole concept of herd immunity. So I will rather say that we should try to go as fast as possible and try to maximize the number of people. That should be the objective. Beyond that, I think this whole concept is very difficult to comment upon at this time.
Dr. Sarin, please, sir, what's your take on this?
Well, I think, you see, because this is a newer disease, so therefore the numbers one will not be able to state. But yes, definitely when the larger population gets protected, then obviously because it's human to human transmission, therefore the transmission will get reduced. I mean, that is something which is very clear. Now, what is that number? That one will not be able to very clearly spell out at this stage.
Some experts are saying 60%, 70%. I mean, do you agree with them, or perhaps we need a little more?
You know, it is very difficult to say because it is.
Talking of the experts,
as Professor Arora has said, as Professor Arora has said that in certain diseases it may be even 90% plus. But yes, in COVID, what has been cited is around a figure of 60%. That has been cited. That and I will also say that, we'll have to really now go beyond the age of 45. I mean, get even the lesser age groups immunized. That is probably the need of the hour, because, infection can happen at all age groups. It's only that the more serious forms are there in the elderly and in the comorbid situations, and mortality risk is higher. That is why you see government has picked up on these as the early and target groups. But subsequently, I mean, to reach that level of about 60%, you will need to vaccinate the other groups also within society. So I think that will become important. And I'm sure that sooner than later, this policy will come up that, those below 45 may also get vaccinated.
Right. That's important. So we leave it there. Dr. Rohit Sarin and Professor Narendra Kumar Arora, many thanks for joining us, sir. And of course, giving us to light as to what are the important facets of the vaccination, how we need to spruce it up, and of course, the concept of herd immunity and what is that we should be achieving. Well, we have achieved stage 1 in terms of perception that yes, we have been able to deliver a message that this vaccine is safe. The next turn is that we have to make people aware that vaccine is also necessary. Why it's important? Because the pandemic is not over yet. And here is a small appeal to all our viewers. Well, keep wearing face mask in your COVID appropriate behavior, keep washing hands, and also do not forget to maintain the physical distancing. Well, that's it in this edition of India Fights Back. Stay tuned to Sunset TV for more. Thank you. Goodbye.